All right, hey everyone. I wanted to go through a new study that really is powerful, showing the power and effectiveness of supplements and in place of many times these prescription drugs that have all these side effects. And this is one of the blogs that is on our website, optimalhealthsystems.com or OHS, the number 4life.com. But at optimalhealthsystems.com, you can always go to the main website and scan down to the blog. And I put up a new blog every single week. And some of them are just informational, and others are like blockbuster information and studies. And this is one of them. So I wanted to go through it with you. This is one that was put up September 5th of 2023. And it was a new study that shows that there's hope that certain nutrients, in this case L-carnitine, may actually replace toxic statin drugs. And so this is really, really cool because statin drugs, we know, are used for people with high heart disease risk, and they come with major side effects, though, and risks on their own. And a lot of people take them anyways because they're wanting to reduce their risk of heart disease, no matter the cost. But many times the cost is worse. And so we want to get away from them, but still lower our cardiovascular disease risks. And L-carnitine has been proven to actually do that. So the American Heart Association website reports that CBD cardiovascular disease has been the leading killer of Americans for decades now. Now, notwithstanding this, infamous ranking, the website also proclaims that medical advances and preventions efforts have helped Americans fight against it. But guess what? The progress has stalled, according to the American Medical Association. Apparently, this stalled progress refers to the fact that the accepted procedure for treatment, managing cholesterol levels with statin drugs, has failed to rein in, the skyrocketing CBD rates in people. And so that's what they're talking about. But the deal is that if you look outside the Western medicine model, you look at alternative medicine, the actual medicine that actually goes after the cause of disease, it changes. And so even if we acknowledge that some of the cardiovascular disease risk is hereditary, we know that CBD can be reduced when lifestyle changes are implemented in one's life. And this is agreed upon by all the major organizations, from the World Health Organization, CDC, AMA, and of course all the nutritional and health groups, because the research is so strong. So in addition to losing weight, having an active lifestyle and reducing stress, it's now becoming mainstream to acknowledge that besides those things, there are some nutrients that have a potent impact on cardiovascular disease. And one nutrient in particular, talking about today, is L-carnitine. It's so potent that researchers say it has the potential to replace statin drugs as a treatment for some cardiovascular disease patients. So here's some of the basics. L-carnitine is a chemical nutrient. It's similar to an amino acid. Technically, it's a derivative that's synthesized from other amino acids. So it's acquired through the food and or supplementing. Meat, poultry, fish, some dairy products are rich sources of L-carnitine. That puts vegetarians kind of in a different situation, but the body can synthesize L-carnitine from a couple other amino acids. One's called lysine and methionine that you can get in a lot of vegetables and grains and nuts and avocados and things like that. So you're still able to synthesize L-carnitine even if you're on a plant-based diet. So here's the study. The researchers, it was in Iran, investigated the possibility of using L-carnitine supplements as an alternative to statin drugs. So it was a straight up study against the two for combating low density lipoprotein cholesterol, the really bad LDL cholesterol that really raises heart disease risks. And the researchers, it was a university called Tabriz, and in Tabriz in Iran, they did this umbrella meta-analysis. And what that means is they took 13 different studies. A meta-analysis when you take multiple studies and then you have some criteria. They're called inclusion criteria. So they found all these studies showing L-carnitine and cardiovascular disease being able to lower LDL. And the ones that met the criteria, they put into this large meta-analysis, and they found 13 studies that met this criteria. And they found that L-carnitine supplements exceeding 2 grams, and that's important. A lot of supplements on the market will say, oh, we have, this ingredient like L-carnitine, and they only have a few milligrams in it. And when that isn't what's needed to really reduce the risk of cardiovascular disease. And that's done a lot with supplements with all kinds of nutrients. So you want to make sure the dosing is correct. So in this study, you had to have at least 2 grams per day of L-carnitine. And the people that did positively changed their lipid profiles dramatically. So the published findings documented that our L-carnitine supplementation was able to reduce total cholesterol, triglycerides, and specifically LDL cholesterol levels. But at the same time, it helped to raise the good cholesterol, HDL. So the high density lipoproteins that actually helps lower your disease risk for cardiovascular disease was elevated. And all the bad ones, LDL, the total cholesterol, triglycerides were lowered. That was really, really cool. So the studies in the meta-analysis, their studies, the 13 studies was between 2013 and 2021. And the age group, which is important, men and women, were between the ages of 26 to 53. So they took L-carnitine and they did a 0.5 gram clear up to about 2.5 grams. And they found that over 2 grams was the key to be able to get the potent effects of L-carnitine's role, because L-carnitine helps to transport fatty acids across the mitochondrial membranes. Mitochondria are like little powerhouses that make energy in the body. And so they enhance beta oxidation, they reduce free fatty acid availability, and they inhibit the bad cholesterol synthesis. So L-carnitine also exhibits an antioxidant and, really important, an anti-inflammatory property in the body. And so it actually helps modulate dyslipidemia and the imbalance of blood lipids, and protects LDL from the oxidative stress. So finally, it was reported that L-carnitine was able to reduce the conversion of these free fatty acids to triglycerides and ultimately prevented the buildup of triglycerides in the body. So it's really important to understand that this is a cool nutrient that, on top of your healthy eating habits, which is most important, your exercise can come in. And the study itself, we're talking about being a possible alternative to statin drugs. So it's really, really interesting. And it's important to know that, in the statin market, the problem is it's a $15 billion market. And 1 out of every 4 Americans over the age of 45 takes a statin drug. So it's big business and it's big pharma. So you don't hear about things like this very often. But L-carnitine is a great nutrient, good, basic, holistic nutrient, amino acid type nutrient that has been proven to safely reduce your risk of cardiovascular disease. And for a lot of you that know, it's used by a lot of athletes, bodybuilders. My wife Hillary uses it a lot, especially getting ready for shows, because it helps to transport the fatty acids out of the bloodstream. It helps to lower body fat. So you get all the added benefits with it besides just reducing your risk of heart disease. So try L-carnitine today. My recommendation is take 3 grams of it a day. It's a little sour, so you can mix it with something. A lot of people will take our glutathione effervescence and put it in water, and with the L-carnitine, and that really masks the sourness of the L-carnitine. I actually just put it in my shakes in the morning. I use a complete nutrition in that, and I don't really notice the taste of it. But highly recommend you looking at L-carnitine if you're at all worried about body fat, and more importantly, your risk of heart disease. Try it today, but eat your healthier foods, keep it raw, keep chewing. Talk to you soon.